right, we're talking all things healthcare. We are back with our experts, Catherine Sevier with AARP, Steve Edmonds with Alliance Insurance Services, and Laura Packard from Healthcare Voices. All right, so this question, Steve, I believe is yours. How do retired people get the food and utility card to assist with monthly needs?
Okay, so that question is going to be pertaining to people that are what we call dual eligible, and that means that they are qualifying for both Medicare and Medicaid. And those folks can buy a particular type of Medicare Advantage policy, and within that policy, it'll provide a card, a debit card, a over-the-counter card, and you can use it to do these things. Like the question asked, I mean, you can pay utilities, you can buy healthy foods, you can buy over-the-counter drugstore products, and sometimes, you know, if you're fully dual eligible, that it can be quite a good benefit. I've seen it $200 to $300 a month in some cases.
Okay, and so if they're wondering if they qualify for that, like where do they get started if they have that question?
You would apply for Medicaid to see if you're Medicaid eligible. That's really going to tell the story on that.
Gotcha. Yeah. Okay. Laura, this person's saying, can I switch every year if I want to when it comes to the ACA market plan?
Yes, you can, and you should at least check out your options every year because plans are always changing, and to make sure you get the best deal, you should shop around every year.
Okay. This next question, I think that, you know, there's a lot of confusion when it comes to healthcare, and we get it. We understand it is a confusing thing to navigate. This question says, does the 3-month change policy apply to those on Medicare as well? And really, the 3-month change policy is Medicare only, correct?
Yes. That's the period that we were just talking about in the other segment. It runs from January 1st until March 31st. And it gives folks that are enrolled in Medicare Advantage plans a one-time chance to change. And that's also a one-time chance for this year's program, the 2024 program. Next year, you'll have that opportunity as well. But you have a one-time chance to jump out of one plan and jump into whatever you would consider a better plan.
Okay.
And, but yeah.
All right.
Great option.
All right. Now, just to make things like really clear as mud, okay? While we're talking about like this one-time open enrollment for Medicare, there is a specific time that you should be enrolling in Medicare, whether you're working, whether you're not working, doesn't make a difference. So Catherine, let's talk about that timeline of when people need to sign up for Medicare.
So everyone needs to sign up for Medicare 3 months before the month of or 3 months after their 65th birthday. And when you do that, you have to sign up for, you will be asked to sign up for Part A and Part B. If you are still working and have a qualified employer-based insurance plan, you may not have to take Part B at that point, but you need to do it if you don't, because otherwise you'll have a 10% penalty.
Okay, we want to show people the graphic that we have. It really kind of helps crystallize what's going on there when we talk about the timeline for signing up for Medicare. So let's look at that graphic that shows it's the 3 months before, the month of the birthday, and then the 3 months afterwards. Now that is for every single person who wants to sign, who signs up for Medicare. Every single person.
Everyone. And that has, and when, if you miss that date, you will pay a penalty for the rest of your life. So it is an important date to put on your calendar. If you're turning 65 this year, that should be your #1 opportunity to protect your future.
Now here's where people get kind of sidetracked with that. They say, but I am working and I already have insurance. And so that's where the whole deferment of Part B comes out, deferment of Part B. So you're going to sign up for Medicare no matter what, but if you're still working, that's probably what you want to do is defer Part B. Why is that so important, Steve?
Well, if you defer Part B, you will be saving the $174.70 a month that Social Security is going to charge you for Medicare Part B. Everybody's going to pay that premium if you're enrolled in Medicare. Some people pay more if they're very high income folks. but you can defer that Part B if you're still working, and then you don't have to start paying that premium until a later date when you actually retire and kick Part B in at that time.
Yeah, we're all about being insured and also saving money at the same time. All right, we're going to take a quick break. We're taking one more segment of your questions when we come back.